Call this May 9th, 2023 regular meeting of the Burlington Board of Health to order. Please join me in the Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
I'm Dr. Ed Weiner, Chairman, and with me this evening is Andrea Sheehan, Gail Demore, Mary Beth Welch, and remote Vice Chair David McSweeney. Also, Director of Public Health Susan Luminello, Associate Director of Public Health Michael Green, our Environmental Engineer Christine Mathis, and our Recording Secretary Eric Bergeron. As I am required, please note that we are live on and will be taped by BCAT and available for appropriate comments and questions through this video technology. And thank you, BCAT, for what you do for this community, keeping us all aware and so well informed. First this evening, I want to make sure that BCAT is on.
They are.
Yep.
Thank you. We have approval of regular minutes from February 28th, 2023.
So moved.
I have a motion to approve the minutes from February 28th. Is there a second?
I'll second.
Second by Ms. Demore. Any corrections, any discussion, any additions? If not, all in favor?
Aye.
Actually, I must go because we have a remote member this evening. Mr. McSweeney.
Aye.
Andrew Sheehan.
Aye.
Gail Demore.
Aye.
Mary Beth Welch.
Aye.
And I vote aye. That's 5-0-0. Next is Chairman's report. I want to thank our director, Susan Luminello, who accompanied me at town meeting last night. Our 2024 budget was approved without question, as well as our Board of Health revolving account was also approved. I want to thank both the town meeting members, and Capital Budget Committee for their confidence in this board. I also want to welcome back Susan from a 2-week vacation and acknowledge our Associate Director of Public Health, Michael Green, who managed our professional staff and keeping us all fully informed during her absence. Thank you, Michael Green. Last, to everyone watching tonight, as a reminder, the Board of Health will be hosting our annual health fair May 20th and household hazardous waste the morning of June 3rd. Any comments? Anyone else would like to add anything? If not, we'll move on to subcommittee reports. The Board of Health Public Participation Policy Update. Either Gail or...
Gail.
Gail, Gail or...
No, so basically, we left the last meeting stating that we would have a subcommittee meeting. We reached out to members in the community. They have a member from the school committee that is going to join us, and we have a formal meeting tomorrow to review the policy and potential changes. And so we haven't really had the discussion yet, but it is scheduled for tomorrow.
Thank you very much. Need to add anything, Ms. Moore?
The only thing I would add is that I did go to that training on Saturday and they had a little snippet on it, so I think I have some information to share at the meeting.
Good. Thank you, Ms. Sheehan. And yes, Jeremy Brooks will be coming tomorrow night. He mentioned that to me last night at the town meeting. Which brings us to staff reports this evening. First, environmental engineer. I want to point out that this is 2 weeks of reports, March 31st through April 13th and April 14th to the 27th. And I'll note that for all of these reports are the same time period, except maybe for the director who is away. So do we have any questions for our environmental engineer? First, do you think you'd like to present?
I just wanted to Again, the household hazardous waste is June 3rd, but I want to reiterate that it's at the Fox Hill Elementary School at 252 Fox Hill Road. It's not at our normal venue. We will be posting a sign at the normal venue, which is the Francis Wyman School, saying, redirecting any strays to go over to Fox Hill. And I did get approval from Francis Wyman to post that sign to redirect any traffic that inadvertently shows up to go to Fox Hill for the event.
Okay.
The only other thing I would point out is that we finished all the hazardous materials storage permits for the year. So everybody that was required to have one now has one.
Mr. Chair?
Please.
I just have one question, Christine. It was on your April 25th report. Underneath administration, it says job analysis questionnaire. Is that like a survey, like a town survey for your position, or is it department only?
It's for all town A and P positions, so we all had to do it.
Okay, yeah, good, glad. And how does that feedback, that information, is that shared publicly, or is it just shared within the town?
So it was a study that was, that the town administrator brought to the town meeting, that's been financed by town meeting, to look at the A and P plan, to see if it needs any changes to that plan. So everyone who's in the A and P has done this questionnaire, and then the study is gonna be done, and then the recommendations are gonna be taken to town meeting, and then, by the town administrator. And then, I'm not sure, if they're gonna publish a report or what they're gonna, I'm gonna assume so,
Okay.
since it would be public information
Yep.
given to town meeting.
So tell everybody what AMP is.
I was Ed, I
Yeah,
was
so
gonna ask that.
basically, it's the non-union
Non-union,
management type
okay.
of positions.
Okay, thank you. Thanks, Christine.
I had one question. You mentioned to me about a month ago that there was a ancient laboratory that would be disposing of some historic materials at household hazardous waste. We thought maybe we'd be able to save some of those. Is that a possibility? You were going to speak to the vendor.
So it was a personal collection of a retired chemical engineer. And I did put the question to our hazardous materials vendor, and they are checking in on that to see if they could decant some of the bottles and retain the bottles. They'll let me know.
Thank you very much.
Yep.
Any other questions? Mr. McSweeney?
Not a question, but a comment, and it really has nothing to do with the staff report other than.
It just made me remind of the work around it, and I wanted to thank you, was the work that was done last, I guess, fall, could have been summertime, at the old Burlington Auto Parts for the runoff into the street, which was a safety concern. Got fixed, and we made it through the first winter with the fix in place, and it looked like it was operating smoothly and as planned. I just wanted to thank you for the work around that. That was a lot of years and a lot of meetings back and forth. And also, kudos to the board for staying on top of it. But I thought it was well done, and it looked great, and it worked over the winter time. So I just wanted to comment on that.
I have one question.
Yep.
I happened to go over to the small shopping plaza where we had the flooding parking lot, and it was very flooded with water bubbling up through the catch basin like a geyser. Are we going to be looking at that at any point?
Weren't they scheduled to do the inspection and maintenance last month?
Yeah, I had reached out to them in April, they said they were doing it in May.
Okay.
When they were here, they said that was the time frame that they were doing it. I don't know if that work has begun on cleaning out that basin. So what I was going to do, and I had discussed this with David, because he had asked me this question, was ask them to come in June, to our June meeting, for an update on where they are on fixing the issue.
Thank you. Do I have a motion to approve the environmental engineer's report?
Motion to approve.
Motion by Ms. Sheehan, second by
I second.
Ms. Tamori. All in favor?
Aye.
Aye. Well, we have to do the call.
Oh, that's right.
Ms. Sweeney?
Aye. Sorry, folks, aye.
No, Ms. Sheehan?
Aye.
Ms. Tamori?
Aye.
Ms. Welch?
Aye.
And I vote aye, 500. No one caught me. I see nobody here in the room except the Board of Health. I see nobody online, but I didn't ask, is there anybody online through Facebook or whatever for Citizens Time? I made a mistake. I want to make sure there is nobody out there. I see nobody.
There's no.
There's nobody there, so, but thank you. Please, the recording mention that we did do that. Okay, thank you. Which brings me now to the Associate Director of Public Health, again, through the times that, to the 4 weeks that we mentioned earlier. Do you have anything you'd like to present?
Actually, I just wanted to reiterate something you had mentioned earlier about the health fair. It's not gonna be this weekend, Mother's Day weekend, we got it for the weekend after, so May 20th, from 10 to 1 at the Burlington High School. So last year we did it out on the Common, this year we're back at the Burlington High School. We got both the wood gym and the rubber gym for vendors, presenters, and then for exercise demonstrations and complimentary classes.
Any questions for the Associate Director? I have one. How many vendors do we have?
Well, right now, I think we have 57 tables, and we might have a couple more trickling in.
Thank you very much. And I know it's a very diverse group in terms of the types of industries and the types of services.
Everything from the head to the toe.
Okay, thank you. And what time does this begin?
It's gonna be from 10 to 1.
From 10 to 1. And I hope everybody can make it for that. It's always an excellent program. Thank you. If there's no other questions, Mr. McSweeney, do you have any questions?
I don't, I'm good, thank you, Mr. Chairman.
Okay, then I need a motion to approve the Associate Director of Public Health.
So moved.
I have a motion by Ms. Welch, second by
Second.
Ms. Sheehan. All in favor, Mr. McSweeney?
Aye.
Ms. Sheehan?
Aye.
Ms. Demore?
Aye.
Ms. Welch?
Aye.
And I vote aye, 500. Which brings me now to the Director of Public Health. Now, Susan Luminello, our Director's report, includes the health agent, the Associate Health Inspector, and and her own. Did I miss any? So let's first go through the health agent. Are there any questions or anything you'd like to bring up about the health agent? I just would like to reserve the right to have her and ask her questions at a later date when she's here about a couple of things, if it's okay. And again, I want to thank her for the program on ServSafe that she did for this community. There were 16, I did ask her, there are 16 people who took that course. So let's now go to the Associate Health Inspector. And is there anything you'd like to bring up? Anything? She had a keeping of animal complaint in her report. What was that?
So, that was, somebody had heard a rooster, and we had permits, somebody with a permit in the area. She followed up with the person, and it ended up not being a rooster. Evidently, it was a rooster recording that they had going to.
You can't make this stuff up.
Evidently, it makes the hens lay eggs when they hear the rooster, so they were playing a rooster recording. It wasn't an actual rooster. So
Interesting.
we asked them
I
to
didn't know
turn
that.
down the volume of the rooster recording. So it wasn't an actual rooster.
Do they have to really actually turn the volume down?
I think
We don't
they-
have a noise audience.
Well, right, so then, yeah, I mean,
But nice that they did, but I'm
Yeah.
just saying.
they said they would turn it down, so.
Told you,
They
you
can
can't
do
make
it
this
till
stuff up.
11. Can use that. Noise till 11.
All right. Mr. McSweeney, is there anything you'd
No,
like?
there's a joke in there, and I just I'll let it go.
I'm not going there. You know, that's a new, somebody
It's a first.
came up with that, you know, making a lot of money recording roosters and selling that on the internet or whatever. It's only in Burlington. Thank you. Which then, if there are no other questions, we'll go now to the Director of Public Health, which includes anything involving nursing also. Are there any questions? You'd like to present anything first?
Yeah, I could talk a little bit about the community assessment report that came back from DPH. This was based on the questionnaires that were given to the 3 health directors. Very extensive, took me about an hour to fill it out. So if you can see, it wasn't super helpful, didn't provide a lot of feedback. They scored us in meets performance standards in different areas, as you can see that on one of the pages. And we got basically in the high 80s or 90s for each category, except for the disease control and prevention. And I'm not sure why we didn't get it in that, but maybe it's because we just don't have a public health nurse at this time. So what we were supposed to do, or what I'm tasked with, was to get the results of this capacity assessment, and based on that, do a work plan for fiscal year '24. So I'm working on the work plan now, which is due the end of May. So for my next report, I'll provide a copy of the work plan for the next fiscal year in that. But I didn't really, there wasn't a whole lot of areas that I could take from this capacity assessment to do a work plan. So I kind of tailored my own work plan. And we'll be submitting that to DPH, different areas for us for that group to kind of work on. So you'll see that next time. So we have had a couple people starting actually this week. So we had Rashad Blades. He's an RN. He's the part-time PHE nurse. Jessica Messina, who is a social worker. Jackie. Who's a social worker. She's the part-time community health outreach worker. So she started today. And then we're also going to be having the epidemiologist starting the end of May, and then the health inspector starting in July. So.
And what will the community outreach person be doing?
So that's what I'm trying to work on in the work plan, is to find different things that she's going to be doing. But I think one of the things that I did put in the work plan was tasking her with, first of all, getting to know the communities, each community, getting to know the groups, maybe having meetings with different groups. She went to a meeting today with Mike, the Burlington's community team meeting, and she met the other social workers in the town. And I took her around. She met with the social workers in the COA, so collaborating with them on public health programs and things that we could do in the 3 different communities. So that's the type of thing that I'm going to have her working on. And so I think, you know, a majority of the beginning part of the work plan is going to be that, making those contacts, getting resources. She's going to be at the health fair. She's going to have a table there. She's going to try to get some stuff together real quick on resources that are available in the town, you know, for different mental health resources or addiction resources, that types of things, and get that together so that she can have some information available at the health fair. So that's the first thing that I kind of tasked her with. So she will be there on that day.
And are they flex schedules, like for those positions, or is it a set hours?
I told them they could flex, but I prefer to kind of try to keep it the same days. So, for example, they might work Tuesday, Wednesday, Thursday, but if 1 week they can't work a Wednesday, they can work a Monday or something like that. So they can flex it around, but just for knowing who's gonna be in the office, I'm trying to keep it somewhat consistent.
And does the towns, the other communities that we are sharing the grant, do they have similar work schedule that our town does for the boards?
So they would be, these people, their work schedule, so for example, if they're working Tuesday, Wednesday, Thursday, they would fit time in the other
Within that
communities
community schedule,
within that
okay.
timeframe. So they might be, going to Lexington or going to Wilmington
Wilmington.
for something else. Or doing a program for all three communities in Lexington, or doing one in Burlington. Really what they should be looking at is the regionally and not kind of separate, so.
Okay.
Trying to kind of get them in that type of mindset.
Just starting, so,
Yeah.
okay, thanks, Susan.
Anybody else? Mr. McSweeney?
Yeah, actually, one question on, in
Your report on the outdoor seating guideline bylaw. Is that, I'm not familiar that we have an existing bylaw in town. I'm assuming that's developing of a new one, or do we have an existing bylaw?
So this was something that just kind of came to my attention as well. It is a bylaw that was passed by town meeting meetings ago. And based on that bylaw, the Melissa Tentopoulos of the Economic Development Department was putting together a document that could be given to establishments to kind of guide them on how to do the outdoor seating and how to get approval and things like that. So one of the things that we had she had distributed this document, and after we looked at it, we had some concerns, basically around the grease trap requirements. So one of the things that it says in the bylaw is that they can have outdoor seating like up to like 50% of capacity of indoor seating. So for example, if they had 100 seats indoors, they could have up to 50 seats outdoors. Well, our issue with that is that their grease trap has to be sized to a certain capacity. So, their seating is going to have to be based on the size of their grease interceptor. So we brought this to their attention, and we're working with them, and she's gonna be making changes to the document, and Marlene's gonna be part of the town's team on approving these outdoor seating requests. So that's kind of like where we're at on that. I think that document, I did edit some parts of the document that they did, basically the parts that pertain to the Board of Health. And they were gonna incorporate those before they distribute it or use it. So I think we're all on the same page now, but I think, we had just seen this and had just become aware of it.
yeah, that's great. I hope that, and that's all.
Very logical change to make, because that totally makes sense. But the one that you recommended about the grease trap limits in permitting, I think the outdoor seating, I guess if there was any silver linings or clouds with COVID, that was one of them, where you saw it throughout Massachusetts, particularly in Boston. They did a really neat job. So I'm glad to see that the trend is continuing afterwards, because I do think it's a nice community addition, right? At Winchester, I just happened to be in Winchester last summer, and they did a great job with their outdoor seating. Although I believe that the same policy I wouldn't be happy with in Burlington. It was jam packed with people in downtown. So I agree that there needs to be some limits around it. But I support it. I think it's a great thing for restaurants, food establishments to be able to have the ability to do that. So that's great. Thank you. Appreciate it.
Anybody else? Because I have a number of questions. We'll start with, someone had a CO2 analyzer and brought it to the movies.
Yeah,
Is that a new one?
yes, that's.
That's two tonight.
Yeah, it was, I guess you can get them on Amazon, which I wasn't aware of until I kind of looked that up, but it's like personal devices that measure CO2. And not totally scientifically accurate when you're trying to, get accurate measurements of CO2. But the concern, I think, with people is that it can be an indication, levels of CO2 in a room can be an indication of the adequacy of a ventilation system. When I first got it, high levels of CO2, if you're in a confined space, you can drop for something. That's in a confined space and very different from being in an open space, but it can also be, it can also tell you how well the ventilation system may or may not be working. So that, I guess, is the idea of carrying around a monitor with you. But like in my email explaining it, there's different factors that need to be considered when you're measuring CO2. For example, the level of CO2 outside, because when you have a ventilation system, you're bringing in the air from the outside. So that's one factor. So if you're going to measure CO2 inside, you have to measure it outside at the same time. So I tried to explain that like in the email.
It was very good, thank you. And
And Christine helped me out on that as well.
I'm sure that's, I have an organics and I have a carbon monoxide, but I don't have a CO2. It's an old joke, I seem to have all kinds of crazy.
Yeah, I know. But the other thing that, that's also very important is that if you are wearing a personal CO2 monitor, it can't be you can't rely on the reading if it's in your exhale zone. Because you are exhaling CO2. And anyone right near you that's breathing out is also doing the same. So there are some factors that need to be considered.
Thank you. Second question, next year is 225 years for the town of Burlington. Have any requests from us to get involved in that yet?
No, I believe it was just at town meeting
Yes.
last night and I think it got passed for funding, for planning for that. I'm assuming the majority of that may be from the rec department, but I don't know. I haven't heard anything.
They were asking for volunteers, and I was wondering if
Oh.
have they asked for the Board of Health to get involved yet?
Not yet.
I'm sure we will. Okay, thank you. Please let us know.
Okay.
And lastly, we have a new director, Massachusetts Director of Public Health, from Mass General Hospital, Robert Goldstein. Has he been introduced to the cities and towns? Yes, public health in cities and towns yet?
I haven't seen anything. I don't know if anybody else has.
I'm going to sometime in June or July ask for a meeting with him.
Okay.
And if so, I'll invite everybody. But yes, I want to speak to him. I have probably bumped into him at Mass General Hospital at some point, at a grand rounds or whatever. But he's highly, highly credentialed, and I'd like to speak to a post-director of public health, post-COVID-19 director of public health, and I'll let him know how, at least personally I feel, and what I think he needs to do for the cities and towns. So I'm going to try to set something up and probably go into Boston. So anyway, I have nothing else. If not, I'll have a motion to approve the Director of Public Health report, which includes all of the other reports.
Motion to approve.
Second.
Who made the motion?
I did.
Motion by Andrea Sheehan, second by Mary Beth Welch. All in favor, Mr. Sweeney,
Aye.
Andrea Sheehan,
Aye.
Gail Demore,
Aye.
Mary Beth Welch.
Aye.
And I vote aye, 5-0-0. We are exactly 7:30, and we have gone through our agenda. Is there anything else under discussion that anyone would like to discuss this evening? I see none. Mr. McSweeney, anything?
I'm good, Mr. Chairman, thank you.
With that, I'm going to ask for a motion to adjourn. Do I have a motion?
So moved. Second.
Motion by Mary Beth Welch, second by Andrew Sheehan. All in favor?
Aye. Aye.
Mr. McSweeney,
Aye.
Andrew Sheehan,
Aye.
Gail Demore,
Aye.
Mary Beth Welch,
Aye.
and I vote aye, 5-0-0. Good night, everybody. We're always around.
Aye.
Board of Health office is always here. Feel free to give any of us a call. Good night, everybody.